Hi, my name is Jessie. I'm 32 years old. I'm an artist, a writer, a gamer, and I have been diagnosed with autoimmune connective tissue disease and a neurological movement disorder called dystonia. The autoimmune connective tissue disease attacks my soft tissues, including my joints, and the movement disorder causes uncontrollable movements. The combination is pretty ugly, and it's very debilitating and painful. I'm disabled, mostly homebound, and am struggling financially. I'm very thankful for the support of my family. I'm very grateful for it, but there's only so much that they can do, and we are really struggling to cover my medical expenses. I lost my job and my insurance, and my disability claim was denied twice, citing lack of diagnostic testing. Even though I have the autoimmune connective tissue disease diagnosis, they want more definitive testing to figure out the exact type of connective tissue disease. Namely, they want a nerve and muscle biopsy. And without insurance, it's simply not feasible. I simply can't afford to get that kind of testing. And even though they agree that the neurological movement disorder is partially disabling, they don't agree it's fully disabling. Particularly since they are not taking the autoimmune disease into consideration there. And without disability benefits and without insurance, we're struggling just to cover my monthly medications, let alone just actually getting to see the doctor. I haven't seen either of my specialists in over a year. I need to see a neurologist and a rheumatologist, and I haven't seen either of them in over a year. And without seeing them and getting the proper testing, I'm not going to be able to get more appropriate treatment either, because right now I'm only getting the basic treatment for just the basic of my symptoms, and it's not sufficient to have a good quality of life. The neurological movement disorder affects primarily my left side, like this. That's gimpy. I try to keep a bit of sense of humor about it. I call that hand gimpy. The whole left side is usually in some level of uncoordination. I have my good days and my bad. I also have episodes of convulsive activity that are called dystonic storms. They're essentially like seizures, except that you remain conscious during the episodes, and they are very painful.
It's quite painful. It feels a lot like, really bad, like Charlie horses. Oh, this side there.
The autoimmune symptoms come in episodes called flares. I'll be fine for a couple of weeks or maybe a month or two, and then I'll suddenly have episodes of swelling. My joints will swell, my face will swell, my knees, my ankles, my face. I'll get lesions on my face and over my lymph nodes. I am very prone to staph infections of the skin, so I am not supposed to shave anymore. Doctor's orders. They're gross and they drain me. They make me very, very exhausted. Internal inflammation causes a lot of different problems as well. I'll have hearing loss because of problems with my inner ear, hearing loss, vertigo, dizziness, nausea. I'll get bladder spasms, and because of them, they're painful, but I also have incontinence. My teeth are falling apart. I've lost 5 teeth already, and 2 are currently cracked. You can see that one. I actually am just holding them together with dental putty. I get blood pressure spikes, costochondritis, which is a fancy word for pain from inflammation of the chest cavity. I have an unexplained abnormal EKG that it's called an inverted T wave. They don't know what causes it, and I was referred to a cardiologist, but I could never afford to go, so I don't even know what that's about. That's why mixed connective tissue disease is so destructive and varied. It just attacks anywhere that it wants, and with me it does that. It attacks so many different places just gradually and randomly.